Hi, this is Nirupama Chatterjee. I'm a little late with my current presentation because of some preoccupations or pre-engagements. However, today I am once again back with one of the very important aspect of the medical therapies, or when we consult a doctor, what we get is a prescription. Now today I'll be discussing with how to decode a prescription, because all the medical terminologies are mentioned in the prescription, and which is quite difficult for a common layman to understand that. So today's presentation will be on how to decode a medical prescription by a common person who is not associated with the medical field. Now, typically this can be the image of a prescription. Decoding medical prescription terms can be crucial and essential for understanding the prescribed medication and its instructions properly. Any drug can be dangerous if taken in a wrong dose. Knowing how to read prescription abbreviations can protect you from detrimental errors. How to read a prescription, and why is it important to know my prescription? Understanding exactly what your prescription means is invaluable for different reasons. Being clear on which medication should take and which you should avoid can help you avoid adverse drug reactions, which can occur when taking multiple medications especially. In a prescription, what are advised, directed, and must be understood well are mainly name of the drug, number two, nature or form of the drug, in which form the drug had been prescribed, whether it's a tablet, a capsule, a soft gel, liquid, inhaler, injection, or there can be many other formats of medication. Dosage strength of the drug. What is the strength of the dose for the drug? Routes of administration, how it is to be administered, through which route, timing, frequency of the dosage and administration. Now, decoding prescription, the first thing you find in a prescription written is this symbol, that is RX. RX is an abbreviation for the Latin word receipt, or which means take or prescription. This marks the very beginning of a medical prescription. And you can also find SIG, another symbol. That's an abbreviation for the Latin word signa, which means level or directions. It indicates the instructions for the patient on how to take the medication. Again, this can be the image of a normal prescription. Seriously, but how would you decipher or convert code of the prescription into ordinary language? For example, in a prescription, what is written will be drug name, followed by strength, followed by a symbol, followed by another symbol, and followed by another symbol. What goes into a prescription? A standard medical prescription usually includes a few key pieces of information like name of the drug, strength, and recommended dosage. It will also include specific directions for how you should use it, the total quantity of the medication that is being prescribed, and the number of authorized refills that you have before the prescription will need to be renewed. By refills means one prescription for how long you can use it before you go to a doctor to consult for a change in the prescription. Now, typically a prescription will have the drug name followed by a strength, followed by a symbol, followed by symbol, followed by symbol, and followed by symbols. Now, what are those symbols? To start with, the first part of a prescription is the name of the drug. It can be a brand name or generic name. Like for example, if you have a fever, a doctor may prescribe a fever controlling medicine. It can be a brand name like maybe Calpol 650 mg, or it can be a generic name like paracetamol 650 mg. The next part, 250 mg, denotes the strength of the drug. What is the strength of the drug that had been prescribed? In this case, it is 250 milligram. PO or PAROS means the medication is taken by mouth or orally. BID, which stands for BID bis in die in Latin, actually means twice a day. That is, the drug has to be taken twice a day. And then X, or the multiplication sign, indicates this prescription is taken for a period of 5 days. So this is how it is decoded. It's a kind of like the X in multiplication. This is how generally a prescription can be decoded. Some common terms in a medical prescriptions used frequently like SIG or RX. This is an abbreviation of signa or prescription, indicating that the following information is the actual prescription or medication order from a doctor. Medication name, the name of the prescribed medication, which could be a brand name or a generic name, as I explained. Dosage, the specific amount of medication to be taken at one time. This may be written in milligrams, micrograms, units, or other units depending on the drug. A route, the method of administration, indicating how the medication should be taken, such as orally or intravenously as an injection, or intramuscularly again as an injection, or even as subcutaneously again as an injection, etc. Frequency, how often the medication should be taken, usually expressed as a number of times per day or week, as for example, once daily, twice daily, or 6 hoursly, etc. Duration, the length of time the medication should be taken. It can be specified in days, weeks, or months. Dispense quantity, the total amount of medication to be provided to the patient, typically written as a number of tablets, capsules, or volume in milliliter. Refills, the number of additional times the prescription can be refilled without the need for a new prescription. Some medications may have no refills, while others might have several refills. Now, the ideally or typically, the prescription will have the patient information with patient's name, date of birth or age, and other identifying details. And it will also contain doctor's information, the prescribing doctor's name, contact information, and possibly their registration number. The common abbreviation which are used or found in a prescription may be OD. OD stands for once daily. That means the drug has to be taken just once a day. BD or BID, which stands twice a day, that is, the drug has to be taken twice a day or 12 hourly. TID or TDS means the drug has to be taken 3 times a day or 8 hourly. QID means the drug has to be consumed 4 times a day or 6 hoursly. QOD suggests every other day, that is, the medication should be taken every second day. PRN stands for as needed. This indicates that the medication is to be taken only when required and not on a fixed schedule. SOS, if occasion required, if necessary. For example, suddenly a patient develops asthmatic attack. Now, he can immediately go for his inhaler. So that will be SOS use of his inhaler. AC means before meal. The drug has to be taken before meal if AC is mentioned. Now, for example, many a product like omeprazole, pantoprazole, which are usually taken early in the morning in empty stomach or before meals. PC stands for after meals. That is, that medication has to be taken after meal. If SL is mentioned, that means the drug has to be used sublingually below the tongue. OD means right eye. OS stands for left eye. AD stands for the drug has to be used in the right ear. AU stands for both ears. CF, if it is mentioned, that means the drug has to be taken along with food. HS stands for at bedtime. ALT.H means every other hour the drug has to be taken. AP stands for before dinner. Now, routes of administration. How the drugs get administered. PO stands for parves, which means by mouth. It indicates that the medication should be taken orally. IM, that is intramuscular and injectable. It indicates that the injection should be administered into the muscle. When it comes to IV or intravenous, it indicates that the medication should be administered directly into a vein. SC or subcutaneous indicates that the medication or the injection should be administered just under the skin. PR stands for per rectum, suggesting the medication should be administered rectally. And VAG stands for vaginally. That means the medication has to be inserted vaginally. Now, the dosage forms topical. It indicates that the medication is to be applied on the skin surface. Ointment stands for ointment again, OINT. It's a topical medication with a semi-solid consistency. CAP, as we all know already, stands for capsule. It refers to the dosage form of the medication in capsule form. TAB stands for tablet. It refers to the dosage form of the medication. IN, if it is mentioned, that means it is to be used intranasally. And the drug administration fastest route, this is a chart, like intravenous acts within 30 to 60 seconds if a drug is administered intravenously. Same thing if it is administered intraosseous, then it takes 30 to 60 seconds. Endorectally, if it is administered, it takes 2 to 3 minutes. Inhalation takes 2 to 3 minutes to act. Sublingual takes 3 to 5 minutes. Intramuscular takes 10 to 20 minutes. Subcutaneous drug acts in 15 to 30 minutes. Rectal acts in 5 to 30 minutes. Injection acts in 30 to 90 minutes. And transdermal is variable. Dosage form SUSP, if it is mentioned after any drug, it means suspension. It refers to a liquid medication with particles that settles over time. Mostly in pediatric formulation or dosage, suspension is being used. SOL stands for solution. It refers to a liquid medication that is evenly mixed and doesn't settle. Inhaler is a small handheld device that delivers medication directly to your lungs. Inhalers can be dry powder, metered dose, or soft mist. Mostly COPD patients or asthmatic patient uses inhaler. Then comes nebulizer, are larger and use a battery, or you plug them in. Use them with a mask or mouthpiece. Nebulizers deliver the medicine over several minutes rather than in one breath. Dosage forms continuing. TSP, if it is mentioned against any drug, it means 1 teaspoonful, or TBSP, if it is mentioned, it is tablespoon. SUPP means suppository. SYR, if it is mentioned, you can well understand it's syrup. STAT, that is stat, means the drug has to be used immediately. If CR or SR is mentioned, actually that means controlled release or sustained release, means the drug that you have taken, it will not be released immediately into your system. It will be gradually released in a time-bound manner as the tablet or capsule has been formulated. LA stands for long acting. There can be injections or there can be drugs which will act over a long period of duration. Dosage strengths. Now you may find certain strengths mentioned as NG, which stands for nanogram, MG stands for milligram, MCG stands for microgram, ML stands for milliliter, G stands for gram, bolus as a large single dose, usually intravenously. There are certain investigation terms also will come across in any prescription. Now if it is mentioned H/AO, that means history of, means if the patient has certain history and if the patient has narrated that to his doctor, he will mention that as HO. NAD, that is no abnormality detected. Many a time you find NAD mentioned in a prescription. When the doctor has not found any abnormality, apparently he will mention NAD, that is no abnormality detected. LMP is last menstrual period. BP stands for blood pressure. Of Hg, that is millimeter of mercury. In fact, that's an unit for measuring the blood pressure. HTN, if you find mentioned in any prescription, it indicates the patient is having hypertension or high blood pressure. DM, if it is mentioned, it suggests the patient is having diabetes mellitus. FBS stands for fasting blood sugar. PP stands for postprandial blood sugar, that is 2 hours after food had been taken by the patient, the blood sugar level. RBS stands for random blood sugar, that is at any point of time if blood sugar measurement is taken at any point of time, then it can be called as random blood sugar. CXR, that is chest x-ray. If you find CXR is mentioned, then the doctor is advising you to go for a chest x-ray. If USG is found in any prescription, that means the doctor has advised to go for an ultrasonography. CT scan, if it is mentioned, it means computerized tomography scan. MRI, if it is mentioned, that the doctor has advised the patient to go for a magnetic resonance imaging. ECG, if it is mentioned, that means electrocardiogram diagnostic for heart, and here is a sample of a normal ECG. EEG, if it is mentioned, it stands electroencephalogram, that is recording of the brain activity, and that had been advised by the doctor. If LFT is mentioned, then you can understand it as liver function test, which contains of SGPT, SGOT, and certain other factors. Urinary means urine for a routine examination. Blood RE stands for blood for routine examination, and occult blood. Occult blood is something which actually is suggestive if there is any kind of hidden bleeding or concealed bleeding. Biopsy. Collect sample of cells for testing in the laboratory. Then comes FNAC, that is fine needle aspiration cytology, that is another form of biopsy. In fact, the samples are taken to test for carcinogenic thing. Endoscopy, procedure that allows a doctor to view the inside of a person's body, for example, like esophagus, stomach, colon, etc. Thyroid function test, that is T3, T4, TSH. Lipid profile test. The doctor may mention a lipid profile test, which mainly consists of cholesterol like LDL, SDL, and certain other parameters. Kidney function test, which will go for blood urea, uric acid, serum creatinine, and others. Lung function test or pulmonary function test, it is mainly done for COPD, chronic obstructive pulmonary disease, or asthmatic patient through a spirometry test. It's essential to follow the prescription instructions carefully and consult with a healthcare professional if you have any doubts or concerns about your medication, tests, etc. To be sure, consult your healthcare provider or pharmacist for clarification. For more such informative, relevant, useful, helpful, practical medical tips for you, your near and dear ones, please subscribe to the channel. This is my YouTube channel. On the right side of your screen, right hand side of your screen, you will find the subscribe button. Please click the subscribe button if you have not done yet. And I sign off with my usual laughter dose, which follows. Yes, never let them know your next move. Meanwhile, requesting once again to please subscribe to my channel, like, comment, share. Thank you for being with me, and I'll be soon back with another exciting topic. Thank you. Good night.